A new literacy program is being used in parts of South Africa following the work of Springfield College professor Jennifer Stratton. She joined me in the studio to discuss the details.
Well, it actually started, I'm a doctoral student at AIC, and it started during a lecture by Harold Robles, who is the founder of MKI, which is Medical Knowledge Institute. And they're a nonprofit organization that does most of their work in South Africa. And during his lecture, he was showing the incredible work that he was doing in South Africa regarding public basic health education. So how does that tie into education? Well, what I noticed was during his lecture that there were many children in the pictures in the background that weren't engaged in activities that I would thought were typical. I didn't see them necessarily playing and reading and writing while their mothers were being trained.
And so we're talking about a younger group of children, probably toddlers,
birth, preschool.
Okay.
Preschool. And so I really stuck with me that here was this man doing this incredible work, and I wanted to be a part of it, and I felt like I saw a need in these. I thought there's something I can offer. So I went back and started thinking about what I had to offer, and my passion is literacy, and I was once a reading specialist, so I then designed a curriculum around early literacy for the organization. So why South Africa, why Cape Town, Johannesburg was where Medical Knowledge Institute was doing most of their work. And I saw an organization that was doing great work that I wanted to be a part of.
And you saw that need. So when you developed the field work, it was 2011 and into 2012 when you were developing it. And we hear so much about early literacy, especially in the Springfield area and Pittsfield and Holyoke as well. Can you kind of explain what differences might exist between typical literacy work for this age group in our population in the way you might approach it there? Is there a difference since you're working in different environments?
Actually, that's a great question. There really wasn't as much of it. And what I did was I piloted it here in Springfield. So I designed the curriculum looking from birth to 5 about how do we develop early literacy skills among young children. And most importantly, how do we help caregivers understand the importance of immersing children in early literacy every day, every moment of their day. And so what I did was I worked with the New North Child Care Center and trained their caregivers and did some training on early literacy and piloted there. And then I also worked with a preschool and some of the caregivers there. And what I would do was then I take the training and what I learned from those caregivers, talk to some of the MKI, Kirsty Hunt, who is a worker in South Africa with MKI, speak via Skype, talk to her about it, and then we kept revising it and then finally had it ready. But the issues here in Springfield regarding literacy and early literacy development are so similar to what the needs were in South Africa.
So then when you went there in July and you did 2 days in Cape Town and 2 days in Johannesburg, working with an existing group of women through a nonprofit there, how were you approaching it? Were you just teaching the women? Were there children involved too at that point?
Actually, it was just, they're called mamas. So the mamas are the community leaders, and they run creches and orphanages for nearly 10,000 children they service. Incredible. I went in an orphanage and saw some of the children that were going to be benefiting from the program, but I did not work directly with the children because the goal was to train the caregivers and the mamas were planning to train other parents and other caregivers in their community.
And mamas there is kind of, with this organization, is shorthand for a woman who's going to go out and affect some change in her community. She may or may not be a mother.
Exactly.
But it's more of a term of endearment, right?
Yes, and they're very empowered women, is what I like. So the term mama is endearing, but it also means a very empowered community leader.
And do you have any sense of the number of children that you think will be reached through these women?
Yes, when I spoke with MKI, they were looking at a total of 10,000 children would be benefiting from the program.
Wow. And so one of the teaching tools that you developed while you were there was an actual book, because you brought backpacks from here full of lots of different school books for children, reading tools and chalk and other sort of learning tools. But how did you come to think about making books with them? Yeah,
well, the training, you're right. I brought backpacks full of 20 multicultural children's books, but they're all written in English. So, and South Africa has 11 official languages. Right. So to meet the needs was one, And also, I didn't, as much research as I did, I couldn't find the story of the children that we were really going to be servicing published in books. So part of the training was helping the women understand that they needed to write their story and they needed to write the children's story. But how do you do that when you have limited resources,
right.
limited paper, limited access to writing materials? So what happened was over lunch, in between one of the trainings, I was talking with another fellow MKI trainer about what can we do to show them. They understood the importance of story, but now what can we use what's around us? So we literally looked around the lunch table to see what was around, and we found an old cereal box that was in the back, paper, these are sugar packets, and a napkin, and with it, and a broken rubber band, which is great for binding. So we actually made a book out of trash.
Simple and effective.
Exactly, and the only thing that I wish that was different, so we had colors, we had numbers, we did shapes all in one book. The only thing was that was only in one language, which I wish it could have been in multiple languages, which I know the mamas would have done.
Yeah, absolutely. And I know that most of the women you were training do speak English in addition to the many languages that may have spoken.
Most of them are multilingual, yes.
And you mentioned Skype a few minutes ago. Have you been able to follow up with these women that you trained this summer to see how they're using this now?
That's a great question. So the technology is limited for some of them, the access that they have. Some I have received emails though, asking questions, more questions about child development or about literacy or maybe how to set up their area. So I have gotten some emails regarding kind of problem solving, and some just live in really rural communities where they don't necessarily have as much access to the technology. But through MKI, I've known that MKI is doing the training in some of the townships through some of their MKI trainers.
So the work will continue, the field work that you piloted here in Springfield will continue in South Africa. Do you have plans to take it elsewhere?
That's it.
Hopes, maybe?
Let me think. I think that's the best way to say it is I do hope. I do hope it expands. One of the really important pieces to me was that it was sustainable. And I think that's what we did in South Africa. It was training community leaders so then they can go out and impact change, and it could be sustainable. So what I think I'd be looking for is another organization to collaborate that's as committed to their community and also committed to making something sustainable. So I will be doing some work locally, but yes, I'm always up for more adventures.
Great. Well, thanks so much for coming in and talking about your work.
Great. Thank you.